your Feel Good Breakfast show. It's Expresso right here on SABC3. Now, Graham, there are an estimated 7 million people living with HIV and AIDS in South Africa, and there are still 180,000 AIDS-related deaths that happen every single year. But there is always hope.
Yeah, and a brand new hope at that. A friend of Expresso, a close friend, Dr. Sivo Marikana, recently caught up with Dr. Carl Diffenbach from the US National Institute of Health to find out a little bit more about an innovative new study which tackles HIV-related heart disease. And what's most notable, it's one that South Africans can be a part of.
For years, medical researchers, government agencies and other health institutes have been looking at ways to improve the health outcomes of people living with HIV and AIDS. With the advent of antiretroviral medication, more and more people are living longer and healthier lives. However, with longevity, this group is now more exposed to HIV-related heart disease. An innovative new study called REPRIEVE hopes to tackle the high rate of HIV-related heart disease. Dr. Diffenbach, thank you so much for joining us on Expresso. Can you tell us a bit more about the REPRIEVE trial?
The REPRIEVE trial takes HIV-positive people who are very well controlled with regard to their HIV disease, but deals with a consequence of treated HIV infection. That is that there's a higher rate of heart disease, of about 100% increase in men and women. And the goal then is to use a drug called a statin to prevent that heart disease in this population, to give people living with HIV a longer, healthier life.
In terms of developing countries, we see a lot of AIDS-related complications. Doc, how does HIV relate to heart disease?
So it's really quite interesting. Remember that HIV is an infection for life. Nobody's ever been cured of HIV infection. But even with therapy, the best HIV treatment we have today, there's still what we call residual immune activation or residual HIV disease, even when you have no virus in your body. It's that residual immune activation or residual disease that is the cause of the cardiovascular disease, of the heart disease that we're seeing in HIV-positive people.
So, Doc, who can participate in the study?
So there's the age limit is 40 to 75. There's a score or a risk factor score that your physician or healthcare provider will work you up for, because everybody with HIV infection is at higher risk of getting cardiovascular disease, getting heart disease. We encourage you to go see your healthcare provider and see if you're eligible for this trial, for your own health as well as to help our future generations.
Doc, clinical trials set the bar for clinical research. How long is this trial proposed to go on for?
So this is a very large trial. We're trying to enroll 6,500 people around the world, and we're about half enrolled. And because we're collecting a large number of events in men and women, we want to make the results generalizable for all populations, we expect the study to go at least another 2 to 3 years. Hopefully within 2 years or so, we'll start seeing the first results. The drugs have gotten better and better and better over time, to where often we're using one pill once a day. The sooner you start your medication and the better you are at adhering to it, the better your health will be.
Doc, thank you so much for joining us on Expresso. I hope people at home are listening, and hopefully we'll get more people joining this trial.